right. Hello. Welcome to the Dr. Lamb Show. We today have a special guest, Dr. Patel, Jyoti Patel. She's located in Arizona and she's board certified med peds and also has done integrative medicine certification in functional medicine. She is located in Arizona, loves gardening, loves creating safe spaces, and has been practicing both primary care and also integrated functional medicine to all types of people. And so we're so excited to have you here today to be able to kind of tell us about both like how you have been able to approach primary care in a more functional way, and also maybe tell us about your love for gut health. Right, so that's what we're going to go to today. What I always like to ask first off, I guess, Dr. Patel, is how you came to integrative medicine and what drives you to continue to practice it.
So, first of all, thank you so much for having me. I just love having these conversations where we can influence people's thoughts, beliefs, and minds when it comes to medicine. So, thank you for having the platform.
For sure.
I've been practicing integrative medicine for the last, I would say, 6 years. But prior to that, I've been doing primary care, internal medicine and pediatrics. So for the last 18 years, I've been a solo practitioner in a small town just outside of Scottsdale. And I have been the only pediatrician in town and the only female internist in town. And
Wow.
having my own solo practice, I felt like that small town doc. I got to know all my patients, they got to know me, and
Yeah.
I was treating 4 generations of,
I love
from
that about
cradle
primary
to
care.
grave, right?
Yes.
It was
Yes.
a wonderful way to get to know your patient population. And everything was good with the practice and my care. I just felt like something was missing. As I continued on through practice, I noticed that it was sort of a merry-go-round of patients coming into the clinic, the same patients, not really getting any better, the number of prescriptions increasing, but the disability and disease not changing much in the model that we traditionally practice medicine in. Also, there's a level of frustration with patients looking for more. They wanted more, and I wanted to deliver more, but I only had limited tools. I had my prescription pad and I had my referrals, and that was
Yeah.
it. And I
Yeah.
felt like there's got to be more to treating these people, and that's when I was introduced to integrative medicine. A good friend of mine, another physician, had completed the fellowship at the University of Arizona, the Andrew Weil Center of Integrative Medicine, and I got introduced to the information as she was learning it, and I just got this renewed enthusiasm for medicine. I
Yeah.
was like, what? Why did we learn this in medical school? And
Yeah.
so it was good. It was a good transition for me to find a different way to practice medicine for my patients.
Hmm.
And as I started to learn through the fellowship how the importance of nutrition and gut health and emotional wellness and movement and relationships and purpose, I was able to then in live time bring that back to my patients in the clinic. So I'd learn something online through the fellowship and I'd bring it back,
Hmm.
like, okay, let's do some breath work here right now. And the patients were so excited because this is new
Perfect.
information for them,
Yes.
and it was transformative. So,
Hmm.
Dr. Lamb, I think that every physician out there needs to hear this, that there is a better way of practicing medicine. I don't mean throwing out conventional medicine. I mean adding more tools to your tool belt. How can we as
Hmm.
doctors serve our purpose, provide care to our patients in that holistic way, where not only are we good listeners and we're present, but we're giving them other things they can do besides a prescription to reverse or prevent disease.
I love that. Yes, it really is another tool, right? In your toolbox. In that patients usually when they come to you, they don't want to go on medications, and this is like breath work is free and it's all natural, and it's so simple to do, but it's so powerful. And so, whether it's the nutrition, lifestyle, stress reduction, sleep, I know dealing with the whole body is so important, and so natural, and we should be changing the way medicine is being practiced. But I know in medical schools they definitely don't touch on that, right? I know when I was in medical school, we maybe got 2 hours of nutrition classes, which is very, very sad. And I just remember they got some dietitians to come. They gave us a plate and we had some plastic food. And they're like, okay, fill this plate with the plastic food of what you should be telling your patients. I'm like, wow, this is like for grade schoolers, you know?
Right.
But and I had that, yeah, we have that thirst to be able to want to be able to offer our patients more. And so I totally am on board with this whole integrative primary care, that you can practice primary care in a more integrative way, right? Like, so how
Yeah.
does that kind of look like for primary care in
Right.
your practice?
Right. So there's so many different ways that patients and physicians can engage in integrative medicine. There's in the office and outside of the office. So in the office, you have multiple opportunities. You may have 5 minutes to teach somebody breath work. You may
Hmm.
have just 2 minutes to impart upon them the importance of good sleep and give them 5 simple tips. Turn off your technology at least an hour before bed. Stop eating and drinking 3 hours before bed. Try to do something relaxing, maybe read a book instead. There's simple things you can tell people to do into less than 2 minutes, small little bits, and by small steps, because you don't have time to give the people a big lecture. So,
Mm-hmm.
what are the three things that you think this patient's going to benefit most from? Maybe it's journaling because they find themselves stressed and they are dealing with some kind of trauma or emotional past that they need to work through. You can give them tips on journaling. Maybe you tell them to start a gratitude journal because they need to change how they perceive their stress in their life. Very simple things you can do. So in the exam room, you don't have to have a genius comprehensive plan. A lot of times it's those simple takeaway tips, those two, three things that the patient actually remembers that's going to transform their life. You can do it in a
Mm.
group fashion. So I used to have a lot of, I have a classroom here in my clinic, and we have group classes where we can have discussions with multiple people, not during COVID time, of course, but before that, allow for discussions for diabetics to meet together and talk about maybe the social, economic, emotional experience that diabetes can have on the family and on the patient. What a great healing experience. And if you're working in the insurance model, as long as you are established with each one of those patients and you've collected the information to start an office visit and you explain the HIPAA rules, you can actually do a group visit. And as long as you follow the rules, to have, an insurance-based model when it comes to group
Yeah.
visits. I did that
Yeah.
alone. And then outside of the exam room and outside of the office, how you can bring integrative medicine to your community was something that I learned from a 10-year-old girl. Yeah. So I was interviewed by a Girl Scout. She was doing it for her Girl Scout project, her leadership project, and she wanted to be a pediatrician. And she asked me why I went into medicine, what do I do, how do I study, all that stuff. And then she asked me, what do you do for community service? And I was like, I give talks, I donate my time. I had a really hard time coming up with a really concrete answer.
Mm.
And so she got me thinking on that soul question, what is my purpose? And I was like, okay, my purpose is to educate. I want to educate my community about how they can take back control of their health through nutrition, through movement, through social connections, through connection with the earth. And so I decided to champion a community garden in the community.
I love that.
So yeah, and she inspired that project. So anything can come of nothing, really. Just a thought can manifest
Yeah.
into things. And so now we have a 2.5 acre community garden in the town. We
That's
have a
huge. That's
yeah,
huge.
we have 120 organic beds. We have over 400 gardeners. We have beehives. We have a compost program. We have an outdoor
Wow.
teaching kitchen where we bring in speakers every month to do garden to table education on different cooking demos. Um,
Awesome.
yeah, it's been a good community project, but it allowed me to serve that purpose outside of the exam room. So, integrative medicine isn't this concrete idea, and it doesn't have to be in a silo. It could be if you're a physician or a patient and you're interested in this idea of integrating health with everything around you in a comprehensive way, it can be done. It can be done in your home. Maybe you start talking to your friends and your family about the importance of nutrition and the importance of sleep because you heard a podcast or you read
Mm-hmm.
a book or you follow somebody on Facebook. You can share this information with colleagues at work So this process of integrative medicine does not have to be limited to the exam room.
Yes, I love that. Talking about group visits, talking about the community, all of that is just changing little steps at a time too, right? If one patient affects the whole family affects the community. And I love that you also brought up the group visits because we also do group visits. I know you talked about diabetes, and there's a lot, right? There's diabetes, there's blood pressure. The one we specifically do at Lyme Clinic is for fatigue, um, where we deal a lot with people who have fatigue and yet they don't feel like they're being heard, because that's kind of one of the hardest things to diagnose or even to get down to the root cause. And they a lot of times feel alone, and just having that support group, right, to be able to voice their concerns and say, hey, wow, there's other people just like me out there that are dealing with this. And yeah, to be able to not have any extra costs, it's just bills, insurance, and to create that camaraderie. Is really good for these most of them are mostly women of elderly older women, but everyone can be dealing with this, this fatigue, and they love this group class. We've had really good feedback, and education is a big part of this group too, right? That's you're learning about your own health and how you can change, and how that can affect not only like yourself but your family. So um, I love your idea of the 2.5 acres of gardening is a lot. 400 gardeners is a lot, and that definitely you need a big community to be able to do that. And so that's really amazing. You do have these pockets of areas, right? That they don't even have access to fresh groceries, and so that kind of grassroots community project that you guys are doing is just so awesome. That's
And
really awesome to hear.
it comes from the idea that all health begins in the gut, right? Or all diseases stem from the gut. So when you think about this idea of how do we impact a large community in an effective way, and I feel like food is the best way to do that. And we talk a lot about in the community. We talk a lot about how food is not available. Like you said, there are a lot of food deserts out there. People don't have access to healthy food, fresh fruits and vegetables. They only have access to processed goods. They may have financial limitations that keep them from being able to buy organic produce, let's call it that. So the powers that be say you should eat fresh and whole and organic all the time, but that's not always the reality for different communities. So
Mhm.
how do we bring nutrition education to the family, to the community? And I felt like this was a good project, being able to bring the garden so that we can make food affordable. One of the things that we do at the garden is we have 10 beds that are dedicated to the food bank. So we donate produce that's been raised in the garden for free to the food bank for people that come from
Awesome.
areas to be able to also enjoy fresh produce without those limitations. So I think that this is part of that education that you were talking about, Dr. Lamb, is if people are listening to your podcast, are inspired by this and they want to do this in their community, there is nothing stopping you from doing that. We
Yeah.
literally took a lot that was rocks and dirt and turned it into a green space. You can do that in your backyard. You can do this on your patio. You can do this on your balcony. You can do this on your windowsill in your kitchen. So just starting with somewhere like this idea that you want to grow your own food will start to, I think, steamroll. Maybe your family
Mhm.
members, your cousins, your aunts, your uncles, and even your parents, your grandparents might say, I want to do that too. So find inspiration in this type of community effort, and give yourself permission to start with yourself and then try to bring those ideas to others. So gut health is such an important part of functional integrative medicine that it's the
Mhm.
best place to impact your community. And we talk a little bit about fatigue, right? You mentioned fatigue, and most of the people you deal with are women, so they may have hormonal issues, they may have gut issues, they may have brain fog, they may have joint pains, inflammatory conditions, autoimmune conditions. You name any condition, you can find the root in the gut, right? It
Mhm.
comes all the
Mhm.
way down into the gut. And so once we start healing the gut, we can really affect all of these chronic diseases. And that's what I love about functional medicine. And I know, Dr. Lam, you also practice functional medicine. And I feel like that's another place where physicians can add more tools to their tool belt. Integrative medicine gives us that 30,000 view. There's my, that's the view down, looking at the person as a whole. But the functional medicine tools allow you to look for the root cause of why that individual may be suffering from their chronic disease. So when I talk to my
Mhm.
patients, I always do a thorough nutrition history. So if your listeners and viewers are interested in gut health and they suffer from chronic disease and they want an algorithm to help them through it, I love that the 5 R's of functional medicine gives us that platform.
Love that.
So yeah, do you use the 5 R's in your practice as well with your patients?
Yes, yes. It's a really good acronym, but easy way to explain, but also have the patients also understand why we're doing all of these, right? Um, but just to go back and talk about the gut and why it's such an important part. And what you eat is who you are, right? And what is gut? Is it, if you can kind of just break down, is it a stomach, intestines? Is it everything? Is it the microbiome?
Oh, it's everything. It's information, it's energy, it's connection, right? So we think of digestion as just a physical process of taking food and assimilating it, but even your mind is digesting ideas and thoughts. Even your
Hmm.
mind is processing things, and we're either accumulating toxins in our body or we're clearing those thoughts. So even your mind is digesting. And so when we talk about digestion of information, that digestion starts everywhere, from your eyes, your nose, your mouth, your ears, your thoughts, your touch. Everything is receiving information and you're digesting it in some way. So
Mm,
some people will say you are what you eat, but I say you are what you digest, right? And so
I love that.
when you start to think of that process, it's everything that comes into your experience. And at a deeper level, all we are is this awareness of our experience. And our experience, we experience it through our senses, right?
Hmm.
So, and eating food is one of those experiences. So we can break it down there. And digestion starts in the mouth, right? Well, even digestion starts with your senses. When you start seeing that food, we talk about mindful eating, sitting with your food, looking at it, setting up that plate, lots of colors on your plate, the way you smell your food, the way you touch your food. Then that food enters your mouth and you hear yourself chewing and you experience the taste and the flavors exploding in your mouth. And as you receive that food, your brain is already digesting that information.
Mm, yeah,
You're
you're making me salivate right now.
right. It's happening. Even your thoughts are digesting this information right now. When you put that food in your mouth, the food, there's no good or bad food. It's just food that serves you and food that doesn't serve you. So if you're consuming food that serves you in this moment in time, it matters how you prepared the food, what your mental state was, who you're sitting with, your environment when you're eating the food, how fast you eat the food, what you're doing if you're distracted while you're eating the food, the time of the day, everything really matters. So when you eat that food, when you're eating slowly, you're chewing that food and you are increasing saliva and digestive enzymes, and that digestive process has already begun. Then, when you swallow that food, it makes its way into your stomach, but your stomach already received a signal from your brain to prepare itself for food. So, acid is starting to flood into the stomach. And as the food emulsifies within this acid, minerals and nutrients are being absorbed. And then, as that stomach excretes that food further down into the small intestine, like a car wash, your bile gets sprayed and the pancreatic enzymes get sprayed and the undulation of your small intestine and all the enzymes on the lining continuously works on digesting that
Mhm.
information that you put in. And that information is not just energy that we associated with carbs, fats, and proteins, but phytonutrients, that entourage effect that happens in plants and food that
Mhm.
affects our genetics. So it has information in it. And when that information gets absorbed into our bloodstream and touches 50 trillion cells, it's affecting our genetics, turning on and off genes, creating health or creating illness. So when we choose
Epigenetics, right?
epigenetics, nutrigenomics, right? So
Nutrigenomics.
so that's the information in the food that's affecting our genes. And people don't think of food that way, but that's what we should be thinking of. It's how are we affecting the information that we receive and what are we digesting, what are we absorbing. So
Mm.
it's not just what we eat, it's also what we get into our system.
Right? People
And
say
then
like, "Oh, I was born with this. I blame my parents." But no, you can still be able to change your genetics in the way you express it, right? That's what you're talking about through
exactly.
nutrigenomics and food. I love this.
Yeah.
Keep going.
And things really just load the gun, right? Our lifestyle is what fires those bullets. So our lifestyle includes the food that we take in as information, but also our thoughts that we take in as information, what we hear, all the noise outside, the chatter, the people, the toxic information that we might be getting from technology is affecting us. And that's we're digesting that and maybe accumulating toxins in the system.
Mm,
And when
mhm.
you eat certain foods and you don't properly digest that food, some people might experience acid reflux, indigestion. These are signs that we didn't really take the time to properly set up our digestive processes. Some people will experience bloating and gas in their small intestine. They may have an overgrowth of bacteria that's fermenting that food, breaking it down. So, again, it's not just what we eat, it's what we digest. And what we don't digest causes toxicity in our system, can cause an accumulation of waste matter that can make us sick, can increase inflammation. And
Mm.
then I love that you mentioned the microbiome, my favorite ever topic. It's that collective experience in our colon made up of trillions of bacteria and other species of viruses, parasites, and fungi that together make up more genetic material in our body than our own human DNA.
Mhm.
And this information that they carry in their genetic material is so powerful. It regulates every process in our body, from hormones to immune system to absorption of nutrients, making of vitamins, fighting off pathogens, production of neurotransmitters, mood balance. These organisms that live in our colon have the utmost importance when it comes to balancing our health.
They
And
dictate our lives, right? Basically. We don't
we're
think so, but
yeah, we're their meat suit, really. They're the ones that are actually living with NS.
yes.
Uh, and so this microbiome that we have talked about, I think for the last 10 years, maybe people have now increased interest in it. We realize we're just really at the tip of the iceberg understanding the gut microbiome. So I want to be humble in saying that we don't know everything about it. But what we do know is that the Western culture, the people that live in the Western world, have a diminishing diversity and volume of the gut microbiome compared to indigenous cultures. And that
Mm.
may be part of the reason why we're more prone to lifestyle related chronic diseases, such as heart disease and diabetes and obesity and chronic inflammation.
That's very interesting. So you're saying just the variety, because we tend to eat the same foods from the same supermarket that comes from the same soil, right? And that's why we don't have a lot of variety, and they've all been washed clean with lots of, whether it's pesticides or the standard American diet is very limited in feeding our good microbiome. So I can
Here's,
definitely see that.
here's another plug for that garden. So
Yes.
when you garden, you have your hands in the soil. Those soil microbes are part of our gut microbiome. So when we're outside playing in the dirt as kids, or when we're growing our garden, we're consuming that bacteria, and it's becoming part of our gut microbiome. It's helping increase that diversity. And when I garden, I gently rinse off the vegetables and then consume them, and that way I'm still getting a lot of the I'm improving my gut microbiome every day. And I love that you mentioned diversity of food and how it affects diversity of your gut microbiome. Your menu, as long as you keep changing it up, you are improving the diversity of microbiome. So eating the same foods every day tends to um, you decrease the diversity of your gut microbiome. And that's a really important thing, because I think in functional medicine, unfortunately, sometimes what I see is that people go on restrictive diets and they stay on these restrictive diets for a very long time.
Yeah.
And instead of benefiting them, it's actually further pushing them down this path of
Yeah.
illness.
Well, that
manifesting.
comes to the first R, right? So we can finally get to our 5 Rs, which would be what, Dr. Patel?
So the 5 R's is, like you said, an acronym to address gut reset in the functional medicine world. And the first R is remove. And so removal of toxic things that don't serve you can be mental, it could be emotional, it could be people, it can be environments, it can be activities, it could be habits, things that we need to remove from our being doesn't serve us. It can also be certain foods that are not right for us right now. So people may have food allergies, and that's of course something that you would know because it would cause a physical response: swelling of the mouth, throat, tongue, difficulty breathing, hives, rashes. That's a true allergy. And of course, if you have food allergies, you should always work with your doctor. And nothing that we're saying here today is medical advice. It's
Mhm.
only for educational purposes. So make sure that you're speaking with your doctor if you do have true food allergies. The other thing that happens though is that beyond food allergies, some people have food intolerances and food sensitivities. And these don't necessarily show up in an allergy test, but could be affecting your health. And so removing some inflammatory or highly suspect foods for a short period of time before you try to reintroduce it can be beneficial.
Mhm.
And there are many elimination diets out there, Dr. Lamb, and your audience may have had many different ones tried and true here, depending on that. And there's no cookie cutter. I always say this is personalized medicine. Every person is unique, and you should see a doctor and figure out which foods you should eliminate based on your own pattern. Food
Yes.
journaling also is a great tool to write down what you ate and how you felt afterwards, giving yourself a rating to see if there's certain foods you want to eliminate. There's many different ways of doing the elimination part.
Yeah.
So removal of toxins and additives and pesticides and colors and dyes and fillers and
Processed foods.
processed
Yes.
food,
Mhm.
sugar, refined, garbage food, empty calories. Clearly, those are in the R category.
Mhm.
And then the second R is replace, and replacing the proper tools for digestion, such as when I mentioned chewing your food and the saliva that's needed to help break down your food. So mastication is part of digestion. And when we stop chewing our food, then clearly we can have digestive issues further down. So replacing that saliva, those digestive enzymes. Also, acid in your stomach. As we age, we produce less acid. People are taking PPIs and acid reducers, and that can affect our digestion in a negative way. It can keep
Right.
us
If
from
you go to
absorbing.
the doctor, and you say you have heartburn, the first thing they're gonna put you on is maybe an acid blocker, right? And what like pantoprazole, meprazole, but a lot of times those are not medications that are good for long term. A lot of mortality side effects and osteoporosis and a lot of gut side effects, right? And so, what does someone with low stomach acid kind of show their symptoms wise if they have low stomach acid?
So again, it's an interesting thing. You can go to a gastroenterologist. Clearly, they can do a capsule study to measure the pH in your esophagus and your stomach. You can have the pressure measured in your LES, which is your lower esophageal sphincter, to see if you actually have acid reflux or if it's just anxiety. So there's many other ways, but people that have low acid states might still have poor absorption. They may have more, acid reflux even with low acid states. You can have abdominal pain and gastritis, even with low acid states, poor absorption of minerals, like you mentioned, osteoporosis, downstream conditions of having low absorption of minerals can happen. Um,
Bloating also.
Sorry?
Bloating, they can feel a
Bloating.
little bloated, yes.
Mhm, mhm,
Especially
yep.
after they eat, if they're not digesting well, right? They just feel like the food gets stuck there.
And you can do a trial of betaine, of course. You can always do a trial of HCl. You can see if they take that with their meals. Do they feel better? Do they feel worse? And sometimes you can do a trial and error. But again, working with a practitioner is really
Hmm.
important for that. And
Right.
then, of course, the replacement of digestive enzymes, pancreatic enzymes, bile, things that maybe your body is not producing. And a lot of people ask me, why am I not doing that? Why am I not producing acid? Why am I not producing bile and pancreatic enzymes? It can be age related, but a lot of times it's because of the vagus nerve. So the vagus nerve, this is getting down a rabbit hole a bit, but the vagus nerve it controls our parasympathetic function, which is digestion. It's cranial nerve number 10. It originates in our brainstem. It passes through our vocal cords, our airway, regulates our heartbeat, our breathing cycles, including secretion of acid, bile secretion, pancreatic function, and small intestinal and large intestinal motility.
Hmm.
So when we are stuck in fight or flight, which a lot of people can resonate with fight or flight, that's when we're anxious, nervous, angry, cynical, bitter, all those sort of difficult emotions.
Stressed.
Rest, yes, we get stuck in fight or flight and we shut down the function of the vagus nerve. The vagus nerve also innervates the lower esophageal sphincter. So when we are stressed, it can open up the diaphragm, causing more acid reflux. It also can affect the production of acid and it can decrease the digestive processes. So while somebody's maybe working on their mind body balance, I might suggest taking replacements for bile, for pancreatic enzymes, and for acid if needed.
Yeah, that's great. To work on the vagal nerve, do the breathing, get out of the fight or the flight to deal with the stress can also help with your gut. I love that. I think we don't talk about the mindfulness portion enough. So I love that you just keep bringing it up. Like that's a part of digesting is not only just the gut, but also digesting your information and the thoughts that you have, right? So that's great. And then the third R would be
Yeah,
re-inoculate, right?
yeah,
Love the
reinoculation.
micro.
Yeah.
You love
We
the
love-
microbiome.
Yeah, we talked about the microbiome and reinoculation of the microbiome doesn't always come with a capsule and a probiotic, though in some cases that might be helpful. Typically, I suggest doing it with natural ways. The first and only ingredient is always fiber. Fiber, fiber, fiber. Fiber from plant matters helps feed our gut microbiome. It creates diversity, it creates volume, creates balance, helps us with detoxification, helps us with movement of our bowels. So having a sufficient amount of fiber is really the most important part of that inoculation. The standard American diet typically allows for less than 15 grams of fiber a day, whereas the daily allowance should be around 30 to 40 grams. So we need to double our fiber in this country, and that's going to help so many things. Like I said, the gut microbiome plays a role in immune function, hormonal balance, estrogen metabolism. It helps us with production of vitamins and nutrients, helps us detoxify, fights off pathogens, helps in the production of serotonin and dopamine. I mean, I can carry on and on.
Yeah.
But there is a very important role that is missing when our gut microbiome is not healthy.
So just to break it down, the fiber actually feeds the gut bacteria. That's why fiber is so important, right? Because you need the gut microbiome loves the fiber because it stays in your gut and you're able to feed it if it's a good thing. So like examples, like you call those like prebiotics would be fiber is to feed the probiotics. Instead of taking probiotics, you're giving prebiotics through fiber to feed the good gut bacteria, right?
Fibers, like you mentioned, the prebiotics that are especially good for our gut bacteria. And those include things like chicory and inulin and artichokes and onions and garlic and soybeans. And I mean, there's so many good prebiotic foods out there that you can eat. But if you feel like you're not getting enough fiber, of course, you could take a fiber supplement. And if you're really working on a chronic illness and you need probiotics, then talking to your doctor and getting a reputable brand that's effective is important as well. So the fourth R is repair. And so it's important that when we have a chronic state of inflammation in our colon, that we work on repairing the gut lining. Most people don't know this, Dr. Lamb, but the gut lining is only one cell layer thick and it replaces itself every 5 to 7 days. So even if you have an inflamed gut lining, I want to give you hope that with the right tools, you can actually repair the gut lining. And there are certain nutrients, of course, in your diet that can help with that. Glutamine in substances like bone broth can help. Don't take any supplements without your doctor. Supplements such as vitamin A, zinc can really help with that. Tannins and colorful fruits and vegetables can also be beneficial. So repairing the gut lining is the fourth R. And then I love talking about the last R, which again ties
Yeah.
us back to mindfulness, but that's the restore. A lot of times we think that our gut is siloed from our other organs. And in fact, our mind and our body are connected. And if you look at a deeper level, they may be actually one and the same. This river of intelligence that is created by our experiences, our beliefs, our reactions, it's all connected. So when the mind and the body are seen as two separate entities, we are at a disadvantage. But when we start thinking of our mind and our body as interconnected, then we can actually create wellness in the whole body. You can think about how when you're stressed, you have butterflies in your stomach, right? Or when you have abdominal pain, you get stressed. And they're just one and the same. They're a bi-directional network of neurons that connect our mind and our body together. And so when we go to the we go to the fifth R, that's more restoring our mind body connection. And I recommend doing daily meditation.
Yes,
So
yes.
I have my own meditation practice where I, try to put aside 30 minutes a day for my own practice. And I encourage my patients to do so as well. I also like to do a regular form of exercise outside when possible. And I do encourage my patients to connect with nature. And that might be
Mm,
your animal, that might be a body of water, that might be just the earth, that might be gardening again, something that connects you to the planet.
yes, that's good.
Sleep is important. That's also part of the restores, making sure you're getting that 7 to 8 hours of good restorative sleep. And sleep hygiene is really important when we're trying to restore sleep. Finding purpose and connection. Again, when we have purpose in life, when we connect with our loved ones, we feel whole. And that in itself can also heal any digestive issues, really.
Yeah.
So that's it. That's all the 5 R's.
That's it. It's actually a lot, right, to
Yeah.
be able to deal with, but not only in the gut, but in the mind. I love that we brought that up during this whole time. So just to recap, uh, remove is the first R, right? Removing toxins or any bad foods or any anything that could be causing inflammation in you. Number 2R is replace, replacing acid, replacing enzymes or bile if you needed it. Number 3 is re-inoculate, to re-inoculate your gut microbiome, whether it's probiotics, prebiotics, feeding the good gut bacteria, in getting a good microbiome balance. And then the fourth R is repair, whether it's using nutrients with a provider's help, definitely. Don't want to do any supplements by yourself, to find good ways of repairing that gut lining. And then the fifth R is to restore your life back to stress reduction and relaxation, mindfulness, and good sleep, restoring your sleep. So thank you so much, Dr. Patel, for what a wonderful, show we had today to learn not only about primary care, how you're practicing, how you're affecting your community in such a positive way, and also what we can do for our gut. So, if people wanted to find you, what's the best way that they can find you or contact you?
So my website is aimsforwellness.com. So it's AIMSFORWELLNESS.com. And my handles on social media are just my name. So it's Jyoti Patel MD on IG, Facebook, and TikTok.
Ah, yes, very good, very good. And so you are located in Scottsdale, right, Arizona. So if people wanted to come find you, they can also find your clinic over there, right?
Correct.
Oh, that's so good. All right. Well, I'm so glad we had this time to have you as a guest on our Dr. Lamb show. And talking with like-minded people is what we always love to do, and be able to change and rewrite the future of medicine. And so we hope that everyone listening enjoyed this podcast episode. Definitely subscribe, like both to Dr. Patel and also to our own Lamb Clinic. If you are out there looking for help, there's plenty of help from amazing practitioners like Dr. Patel. So thank you for your time today.
Thank you, Dr. Lim.